Hi, thank you so much for having me. I am Shannon von Felden with the EveryLife Foundation for Rare Diseases, and I have been asked to talk a little bit about advocacy and how you and others in the rare disease community can get more involved in advocacy. So to start, I just want to introduce you to the EveryLife Foundation for Rare Diseases. If you have not heard of EveryLife before, we are a nonprofit, nonpartisan organization dedicated to empowering the rare disease community to advocate for impactful, science-driven legislation and policy that advances the equitable development of and access to life-saving diagnoses, treatments, and cures. And here at the EveryLife Foundation, we have a very special advocacy program called Rare Disease Legislative Advocates. And it's a program of the EveryLife Foundation for Rare Diseases, and its main purpose is to support advocates, individuals, and organizations in their policy and advocacy efforts. So we really aim to educate patient advocates like yourself about legislation, both federal and state, and how those policies impact patients, their families, and the healthcare and rare disease treatment ecosystem. And in addition to all of our efforts to educate and provide resources and tools, we also work with advocates like yourself to build awareness on rare diseases and the impact of policy on individuals and their families here on Capitol Hill in Washington, D.C., to ensure that Congress hears directly from rare disease patients and caregivers, as well as working to meet with members of Congress virtually and in district, and to meet with state legislators at state capitals. So before we get into ways that you can get involved as an advocate, let's start from the beginning so that everyone can have equal footing. So if you're not familiar with advocacy, or perhaps you've heard of patient advocacy, we're going to talk more about legislative advocacy today. And so advocacy as legislative advocacy is an activity by a person or a group, like your foundation, of people to influence or change decisions made by the people who make our laws. So that's the basic function of advocacy. And the reason why advocacy by yourself and your organization and others in the rare disease community is so vital, aside from your personal stories and how you are and your family are personally impacted by rare diseases. This is the outlook of rare diseases right now in the United States of America. And these are the facts that impact the ability for patients to get access to treatments, for them to get quality health care, for them to be able to receive a diagnosis. And so these are just the real facts and statistics related to the importance of advocacy right now. So you are probably already familiar with a lot of these numbers, and if you're not, you probably have felt the impact of them. So it takes 15 years on average for a drug to be developed and approved by FDA. There are fewer than 5% of rare diseases that have an FDA-approved therapy, and the cost of having rare diseases in the United States for 1 year for a subset of rare diseases was $1 trillion in 2019, which was cited in EveryLife Foundation's Economic Impact of Rare Diseases report. And many of those costs are incurred directly by families in society. In fact, it's 60% of those costs. And so this is really outlines why advocacy is so important for not only individuals and organizations, for the country in itself. And if you're new to advocacy, advocacy can happen at many different levels. It can happen at your local level, your state level, and your federal. And you might be wondering where you should start or which is most important. And what I will say is that they all have very different functions. And depending on where you live and what state you live in, you might have completely different circumstances. You might have completely different access to healthcare. You might have different access to treatment, depending on where you live. And so where you live could determine your ability to receive newborn screening and diagnostics and to access care and treatments. In every state, every local government has different laws and processes. So it is important for you to understand when you're having a certain experience with your insurance or with receiving a treatment, and understanding what laws are impacting those specific circumstances. And this highlights really that advocacy at all levels is important. But I would caveat that with limited time and resources, we know that it's not always feasible to do everything all at once. So sometimes it's easier to start advocating at the local and state level, and at times, though, it can be dependent on what is impacting you and your family the most. And then I like to show this graphic because it really highlights the process for getting a bill passed through both the House and Senate. I'm sure you're all familiar with that little song, I'm Just a Bill. And unfortunately, it's a little bit more complicated than the song maybe led us all to believe. But what I like about this is that there are so many different points of contact that are so important with your representatives and your senators, from before a bill is even introduced to before it gets to the floor of the House, and then again in the Senate. And so there's all these different points at which your advocacy can make a huge impact on a bill, and what is in a bill and what happens with the bill before it gets passed and made into law, or in either the House or the Senate. And so this is really just highlighting that there are just so many steps along the way where you can make a difference with your advocacy. So we've talked a little bit about what advocacy is. So how do you advocate? There are so many different ways to be an advocate, and I always recommend to people to really lean into their interests, their strength, and what they feel comfortable with their time and energy. What is so important as you begin to advocate is to understand that this is not a one and done thing. It can be, but to really be an effective advocate, you are creating relationships with your state and federal lawmakers that hopefully will continue over the years to where you become a resource and you become a person that they come to with questions about healthcare issues, about rare disease issues, and can really help and guide your lawmakers. That is the most ideal situation. The most effective way to make an impact is to be a continual resource. And so you're wanting to build these relationships so that they can come to you, and when you come to them, they listen. And so when you advocate, part of that advocacy is sharing your story, sharing your personal story, how you and your family are personally impacted by rare diseases, and making sure that there's some kind of ask related to it. It's so important to make sure that there's something specific, because when you leave it open-ended, they're not always sure how they can help you in the best way. So having a specific, what we call a legislative ask, something that they can take action on, something they can impact as a member of Congress or a state legislator, is so important. And then furthering your relationship, asking questions, having that conversation. You can engage with organizations you support, like you are doing by attending this conference this week, and seeing what they're working on and how you can support your organization's advocacy efforts, can go a really long way. And one thing that I love about advocating in the rare disease community is how much advocates support one another, how much organizations support each other. That is just having that unity is so important when you can align with others, and make just such a stronger force. And of course, everything is fun, more fun with friends. So activating your own network, you have family, you have friends, you have coworkers who want to help and support you. So letting them know when there's an issue that's really important to you, if there's a link that they can go to email their members of Congress, or if they can send a letter or make a phone call, letting them know, so that they can take action as well. Some really specific examples of advocacy would be for you to contact your lawmakers when you disagree with something that you see that Congress is working on, or you want them to support an issue, or if you just want to bring an issue to their attention. You can attend events that your elected officials hold, like town hall meetings. They often hold town hall meetings, even if they're holding a town hall on the budget or energy issues. You can still attend, and before or after, see who the staffers are for that member of Congress, introduce yourself and say, you're here, really interesting, but you'd love for them also to know about another issue that you're working on too. And that's a great way to meet them, hear what they're working on, and to introduce some things that you want to bring to their attention. You can create a petition, attend other gatherings and meetings. Sometimes my council member holds like an open office hour at our local coffee shop. Those are great ways to introduce yourself and get to speak to your legislators. You can also send a postcard, a letter, email, make a call, and then, of course, setting up a meeting with your lawmakers in person, which we'll discuss a little bit more. So how can you create these relationships with your lawmakers? Talked a little bit about the examples of advocacy. We talked about what advocacy is, but which included building these relationships with your lawmakers. So when you're wanting to create a relationship with your lawmaker, how do we do that? So first step, meeting with your legislator. Before you even meet with your legislator, though, I really recommend that you research your legislator. They put so much information out about what they're working on, what their priorities are, what their committee is working on, that they sit on at least 2, maybe 3 committees. So what are the committees that they sit on, and what are those committees working on? And that is such vital information, because if you can link whatever you are looking for, whatever you are asking them to do, if you can link that priority in some way to your priorities, you have just made a great, effective pitch, that office. And they put so much information on their website, through their press releases, on their social media. So research your legislators. You can also invite them, especially when working with an organization. If you're having a walk, if you're having a fundraiser of some kind, If you're having just an event that's, you can invite them. Your member of Congress, they live in your district, they live near you. They love to attend events. They love to be able to speak at an event. And so that's a great way to help build those relationships. You can call your lawmakers' offices and share your stories. Ask to speak to their staffers to share more about your story and your family's experiences living with a rare disease. And then anytime that your lawmaker supports a rare disease issue or is doing something positive, something that you support, say thank you. I worked for a member of Congress, and we didn't get so many thank yous. So you can really break through a lot of noise by sending a really thoughtful message to the healthcare staffer for that member's office, saying thank you, either a call, an email, even a social media post, and saying thank you for their support of the rare disease community can really go a long way. And so we've talked a lot about the different ways to advocate, and many of those are here listed on this survey. This survey is a little bit older, but the Congressional Foundation interviewed and surveyed staffers on the Hill on what communications and advocacy forms really made the most impact on the decisions of a congressional office. And they said that the number one was those in-person visits with constituents. So it really does make an impact. And just remember, you don't have to come to DC to meet with your members of Congress. They all have district offices in the district that you can request a meeting with them in their district office. So I know our time is limited. We're parents, we're in school, we've have healthcare needs, we're busy people. And so when should you advocate? I hate to say anytime and all the time, with the caveat that, of course, we're all busy. And so, you have to do what you need to do and fit in advocacy around that. So what you want to make sure as an advocate is that you don't wait until it's too late. When you start to hear rumblings of things happening that you would view as negative for your community, for yourself as a rare disease patient or family member, you don't want to wait until it's too late and there's nothing to be done. And so being vocal early on about the issues you care about is really important. And again, paying attention to a bill's progress and where it is in the cycle. Are hearings being held on it? Is it passed through the committee? Is there going to be a vote on the floor on it? Did the House pass it? Now it's on to the Senate. These are really important key events in the cycle of a bill. And you want to be able to pay attention to those things if there are really important issues to you in your community, and making sure that you're being vocal when those key events are happening, so that you don't have that moment where it's too late to make sure that you're being heard. And one thing that I love, and I've mentioned already, really are those in-district meetings. Not everyone realizes that members go home most of the month of August. Around federal holidays, they usually have a week or two where they're in the district and they're attending events. They're holding meetings in their district office with their staff during those work periods. And so those are really a perfect time to have those meetings in the district office in person. So we have so many different tools and resources available for advocates who are just starting out on their advocacy journey, and those who are pros and just need some additional tools to make the most of their advocacy. And so I invite you to take a look at our website, everylifefoundation.org, click on the advocacy button, and you can go to advocacy tools and resources, and we have tons of resources. I would direct you to the tip sheets. Those really start at the beginning. They run through from fostering a relationship with your member of Congress to how to schedule a meeting with your legislator, runs through steps on how to schedule a meeting. We have a tip sheet on how to create your own one-pager, which is basically a fact sheet, an explainer of a policy issue that you would bring with you to a meeting. Sometimes your organization creates them for you. We have a tip sheet on advocacy and the congressional appropriations process. So I very much recommend, if you're interested in more information and tips and tricks, to check out our tip sheet. We also have really great facts, statistics, and studies on our website as well. So I had already mentioned the EveryLife Foundation did a economic impact on rare diseases study back in 2019. That report is up on our website along with a nice little one-pager explainer on it. We also recently released a study back in, it feels like it was probably 2024. I think so, 2024, on the impact of delayed diagnosis in rare diseases. And it outlines how an average 5-year delay in diagnosis resulted in 4 times more likelihood of seeing 3 or more specialists. That delayed diagnosis shifts healthcare spending away from treatment and supportive therapies to unnecessary procedures, and the importance of eliminating the diagnostic odyssey to ensure that patients get treatment as quickly as possible to avoid ongoing complications. And so I definitely recommend, if this is of interest to you, to also check this out on our website at everylifefoundation.org. And just want to share why the patient voice is so important. And I probably haven't quite touched on this quite so heavily, but there are so many people that are trying to get legislators' ears, and the patient voice really is critical to the process. I love this quote. The patient voice adds a different perspective to everything that goes on in healthcare and can point out real gaps in the system. And this is really the importance of patient advocacy in the context of legislative advocacy. I do want to share just a few things, some opportunities that we have here at RDLA and EveryLife for you if you are interested in taking your next steps in the advocacy journey. RDLA has a lot of different programs listed here. I'm just going to focus on a few different ones, though. Specifically, meeting with your members of Congress. We've talked about this, but we have 2 specific opportunities for that. The first one is actually coming up soon. We hold Rare Across America every summer in August for advocates to meet with their members of Congress while their members are home for the month of August, for the August recess. And so we schedule meetings for advocates to meet virtually with their senators and in person in the district offices. And so this year that's happening from August 4th to 15th. Registration just closed, but if you are interested in participating, you still can. Email Kenley at kjones@everylifefoundation.org if you'd like to register. And then the second opportunity is Rare Disease Week on Capitol Hill in 2026. We will be holding Rare Disease Week in Washington, D.C. from February 24th to 26th in 2026. Registration will open in early January. We also provide a number of travel reimbursements for advocates to attend Rare Disease Week in DC, and that travel reimbursement application opens in late September. So sign up for our newsletter, get communications from us, and keep an eye out for that travel reimbursement application to open if you're interested in attending Rare Disease Week in 2026. We have a few other opportunities to meet with legislators as well. We host 2 to 3 state advocacy days per year. So it's different states each year, an opportunity for advocates to meet with their leaders at their state legislature in their state capital. So keep an eye out for communications in case we come to your state. We also hold a virtual Youth and Teen Advocacy Day in June every year. So we just hosted a little over 50 youth and teens in June who met with 80 different offices. And so if you have a younger advocate in your family who would like to advocate for themselves or a family member, siblings, cousins, are more than welcome to join, as well as the patients themselves. And we schedule the meetings with their lawmakers, and we do age-appropriate trainings ahead of time and provide age-appropriate materials for the youth and teens who are participating. And so that's a really wonderful event as well. And then Rare Voice Awards, if you know anyone who has done some outstanding advocacy this year or last year, our Rare Voice nominations are actually open now. We also, because education is so key, we host a number of webinars to help advocates stay informed and for them to be able to continue to learn about advocacy. So we host monthly RDLA webinars that are really timely on legislation and developments that are affecting the rare disease community. We just hosted one a couple weeks ago on HR 1, the budget reconciliation bill, what actually ended up in there and how that impacts the rare disease community. We host quarterly share your story webinars so that advocates can learn best practices for sharing their story with their legislators and receive tips and tricks, and then actually be able to practice and receive feedback from coaches. So highly recommend those. And we also host quarterly state advocacy webinars so that you can learn more about opportunities and ways to develop your advocacy for state purposes. We also have a fantastic young adult rare representatives program that's open to any advocate between the ages of 16 and 30. This includes the patient advocate themselves, their family members, and loved ones. You do need that personal connection to rare diseases in order to join YAR. But it's a fantastic program that really builds advocate skills for these next generation of rare disease advocates. There's a great speakers bureau where they learn public speaking skills and then receive opportunities to put their new public speaking skills to practice. There's also a YAR Leadership Academy that's an online course for YARs to learn more about policymaking, drug development, and the regulatory processes, which is fantastic. So if you or someone you know fits into that 16 and 30 category, feel free to let them know about YAR. If you click on that QR code, you can learn more. There is an application, but it's very short. And very easy. And it's done on a rolling basis. So there's no deadline to apply for EAR. It's whenever you apply. I thank you guys so much for having me and giving me this opportunity to present virtually. If you have any questions, if you want to learn more, if there's anything that you would like to talk more about, I would be happy to talk with you further individually. So please don't hesitate to email me at svonfelden@everylifefoundation.org. If you do have any questions or need anything, I highly recommend, if this was of interest to you, if you are somewhat interested to highly interested in being a rare disease advocate, please sign up for our newsletter, everylifefoundation.org. It's really the best way for you to receive our communications. You'll then receive information about our advocacy events, about our webinars, and stay informed through our communications. You can also follow us on social media as well. So thank you again so much for having me. And please don't hesitate to reach out if there's anything I can do. Thank you.